in our world, occupational therapy and physical therapy and speech and language pathology, all sit in the rehabilitation sciences sector. So welcome. And what I'll do today is I'll tell you a little bit about the PT program, and then Daniela, who you know much better than I, because she really is the one who runs the show when it comes to admissions. I am on faculty here. I'm a physical therapist. I'm Sharon Switzer McIntyre. And I am the chair of our admissions committee. Do a number of other things and teach another in the musculoskeletal area of the curriculum, and run our bridging program, internationally educated physiotherapy bridging program. But right now I'm wearing my admissions chair hat. So what is physical therapy? Physical therapy is a regulated health profession. It's a profession where we have some controlled acts, predominantly in communicating a diagnosis. So we can do a physical therapy assessment and communicate that diagnosis to our patients. Suctioning, so we can do oral and nasal suctioning of individuals with cardiorespiratory issues. And very soon, we will be able to order diagnostic testing, including diagnostic imaging. There are just a few acts that have to be changed for us to actually implement that regulation, but it is on the books as a regulated act that can be performed by physical therapists now. The focus of physical therapy is towards prevention, diagnosis, and treatment of movement dysfunctions. So we're really all about function. We're about trying to figure out what the problems are, what tissues or structures have gone awry, and then how can we restore that function to an optimal level. To do this, we use a variety of modalities that are mechanical. We use education, we use exercise, we use our hands a lot. We spend a lot of time touching people. So where is physical therapy practiced? It's practiced across a very broad spectrum, which is what I think of all the rehab disciplines makes it really, really exciting. We work across the continuum of the healthcare system. So we work in acute care settings, we work in rehabilitation settings, we work in long-term care and chronic care type settings. We work in private practice settings, sports settings, schools. We really do work across the spectrum. We also work across the lifespan. So we work from pediatric to geriatric and everything in between. And we work across all the systems. So the musculoskeletal system, the cardiorespiratory system, and the neurological system, as well as the real focus is on the multiple morbidities. So you never just have one problem. Even if you think you've just got a simple ankle sprain, I'm a musculoskeletal therapist, so I tend to gravitate towards musculoskeletal examples. Even when you think you've got just a simple little ankle sprain, there's usually something else going on, a muscle imbalance somewhere else that's predisposed you to have that particular problem. So we really do look across the spectrum. And we also play a significant role in health promotion and health prevention. There are a number of physical therapists who work in policy within the government systems, within community centers doing health prevention, health promotion activities. So there's a broad breadth and depth of opportunities within the physiotherapy domain. We also work in the medical legal domain. I know I've done with some of the occupational health work that I do. I've been expert witnesses. I've worked with employers. So I work in workplaces, helping to restore function and return people to work. As the occupational therapist, we also have we call an essential competency profile, which looks at all of the various aspects that it takes to be a really, really stellar healthcare professional. We share the same kind of competency profile with our medical colleagues, our occupational therapy colleagues, and nursing is also looking at this same kind of model. So the expert in the middle, that's your expert knowledge with respect to physical therapy and physical therapy sciences. And then all of the petals around the expert are the skills and competencies that we need to be able to deliver really stellar healthcare and to help our patients achieve their optimal goals. So there's professionalism that's important. There's being a good communicator, a good collaborator, a good manager. And that's not necessarily manager of administrative pieces only. That's a good manager of caseloads and of our patients, being an advocate for our patients, and of course being a scholarly practitioner, because everything we do, we try to really embed in the evidence. What kinds of careers are there available to you as a physical therapist? again, the sky's the limit, which is what's so exciting. I'm a passionate PT, if you haven't actually picked that up yet. So you can be a clinician and you can work across all those sectors that we talked about, which is an extremely rewarding career. Every person brings a different story, a different lens, and always keeps you on your toes. You can work in the area of research. You can combine and be a clinician scientist, so work in both areas. You can work as an administrator, whether that's an owner of a clinic, or we have a number of physical therapists who work as administrators in our acute care and rehab settings where they're actually more at the administrative level as opposed to the frontline acute or patient care line. You can work as an educator where you're not only just an educator, let's say, in an academic institution, but you work as an educator within the community with health prevention and health promotion, where you're educating parents and families and teachers and caregivers about how to restore function and how to maintain function. So I said there's a health promotion, health prevention opportunities. There are physios who work in the smoking cessation programs, in chronic pain management programs. So looking at how do we really start to prevent some of the disorders and diseases and dysfunctions that we see in our clinical lives. Working as an advocate, as a patient advocate, we have a number of physical therapists actually who are working in emergency departments as patient advocates and helping the patients marshal their way through various healthcare environments, which is a bit of a quagmire some days. And then acting as consultants in a variety of ways, in workplaces, with government, with healthcare agencies, with research agencies. There are all sorts of opportunities to work and use your knowledge that you've gained within a physical therapy framework in a consultative role. The job trends for PT, 100% of our graduates get jobs, so 100% of our graduates who graduate get licensed to practice and get jobs. Jobs vary across the spectrum. We've got a shift with the way the funding is working with our healthcare system these days. Probably about 60% of physical therapists now work out in the private sector in various ways and means, and the other 40% are working in our publicly funded systems. There are also multiple employment positions. A number of our graduates, because they really want to work in the acute care area or the rehab area, and they really are drawn to some of the more acute outpatient sports types of environments, they work 2 part-time jobs. So they'll work 2 days a week in a hospital environment and 3 days a week in a clinical setting, or they'll work 3 days a week in a chronic pain management program, and they'll travel 2 days a week with a sports team. Or they'll work in an acute care setting and in a home care setting. So there are a variety of different opportunities that, and mix and match types of roles that people are taking on because they're trying to satisfy their various interests with respect to the breadth and depth that you can practice within the physical therapy realm. There's also opportunities for international employment. Many of us have traveled abroad to work. It's usually very easy to get a license to practice in another country because Canada is recognized so highly and widely from the perspective of the quality of education that we receive here in Canada. Our program in particular is right now accredited by the Canadian or the American Physiotherapy Association. When your cohort comes on board, that accreditation will no longer be in play because the American system has changed to a Doctor of Physical Therapy program. And because we don't grant that degree, we can no longer be accredited by the American system, which is an interesting conundrum because whenever they come to accredit us, and we've always received a 10-year accreditation, which is the absolute maximum, they always comment on how far ahead we are in our practice and our education compared to the US. So we're kind of caught in this little situation where our degree doesn't match their degree, so we can't move forward. We're also accredited by the Physiotherapy Education Academic Council in Canada, and we're actually up for accreditation. The visit is in November, and we've always received the highest level of accreditation with that particular agency as well. Salaries vary depending on the years of experience, the facilities you're working in, the environments you're working in, but full-time salaries can start around $50,000 and they go up from there, essentially. So how do you become a physical therapist? All Canadian PT schools require a university degree. Our particular program requires some specific prerequisites. In order to become, and we'll talk about those in a minute, in order to become a physical therapist, you must graduate from an accredited program. Every program across the country is an accredited program, thankfully, but you must graduate from an accredited program. And you must pass, in physical therapy, we have a 2-stage licensing process where you do a theory-based exam, which is a 4-hour, 200 multiple choice question exam. And then you do a full-day OSCE-based practical skills exam. Those happen at 2 separate times, but you must pass both of those stages before licensure to practice. And then in order to practice, once you pass those exams, you must be registered with a provincial regulatory body. And regardless of where you go to school in Canada, the different provinces have different regulatory bodies, but University of Toronto is recognized across all provinces. Now, why study at U of T? Because, well, I'm a graduate of U of T, so I'm a bit biased, and I teach at U of T. However, I really do believe that we have one of the best programs, and part of that is because we're situated in such a rich clinical environment. When you walked in the building, I don't know if you recognize that we're surrounded by about 6 world-renowned clinical hospitals that are all teaching hospitals and teaching environments that our students have access to. We use diverse teaching and learning methods. We use small group, case-based, clinical practical skills types of learning opportunities. You're in the clinical environment. You're in the learning environment. This is our lecture hall. So you spend a fair bit of time here. We have clinical skills labs upstairs. We have small group rooms. We have facilitated and unfacilitated small group sessions. So we really try to make sure we've got diverse learning strategies so that we meet the multiple learning needs of our students. We have 13 tenure stream faculty who are all, the vast majority of them hold career awards, which means they've been recognized by both nationally and many internationally for their research efforts, who all integrate their research into our curriculum. And we also have clinical faculty who teach many of the clinical skills who are embedded in our internationally renowned and recognized clinical facilities. We have over 200 clinical teaching facilities that we work with for our clinical internships, who also house many of our status-only clinicians who come in and help us teach our program. They come, they facilitate some of our clinical skills labs. They bring their expertise into the building to teach about some of their very specific expertise, which then connects you to an expert when you go out and work in your clinical communities and your home sites. You then have a connection to be able to pick up the phone and call if you have a question about a patient, which is an incredibly rich and valuable resource as you move out into your clinical, your worlds. And then, of course, the University of Toronto has incredible resources. We've got incredible library resources. We've got this building. We've got the medical sciences building where we have a full dissection anatomy lab that all of our students work through as well. Our curriculum is divided into 12 units. So we start with an introduction to the profession. We are system-based, so we talk first about the cardiorespiratory system. We move next to introducing the musculoskeletal system. You then get to go out and play in the clinical environment, which is really fun. And then you come back and we talk about the neurological system. You then begin your research, and all students do a group-based research project in our particular curriculum. You begin your research program and start to write your research proposal. You then go out and do some more clinical internships. You come back and you do an advanced musculoskeletal unit, finish off your research, and then you complete the program by going back into the clinical environment for your one last clinical exposure, which tends to be the area that you may be interested in working in clinically. We really try to challenge our students to really engage in systematic and clinical inquiry. We foster clinical thinking. We try to really enhance the area of moral reasoning. We are more and more convinced that we need good, moral, ethical, clinical reasoners to go out and move the profession forward and work in a collaborative, interprofessional nature with all of our peers, because healthcare is definitely moving and a galloping pace towards interprofessional collaboration with respect to how we deliver care. We really encourage problem solving, independent and collaborative problem solving, and we really try to nurture that innate ability to integrate evidence into practice every time you think about and look at a patient. Our research curriculum, as I said, is probably one of the most involved across the country, where you work in small groups, you conduct original research. So the process is that you would write a research proposal based on an idea that's been generated by a faculty member or one of our clinical faculty. Then you take that proposal through ethics, you collect your data, you analyze your data, you write up your data in the form of a manuscript ready for publication, and you also develop a poster for a research day that we hold here in the department. And many of our students take those posters and papers on to publication and presentations in our local and national and even international conferences. So these are just a couple of examples of some of the research projects that have been done. We've looked at preoperative rehabilitation needs assessment for total knee arthroplasties, understanding essential competencies for Canadian PTs working in a resource-poor country. So they were looking at what kinds of competencies do some of our resource-poor countries have, and a project that I was recently involved in, which was workplace injuries in the Canadian physiotherapists. So we looked at how frequently and what types of injuries do physical therapists incur while they're working, and how frequently or not do they report those injuries. You can look for the article to be published. Our clinical education realm is, again, one of the best in the country by the nature of where we sit in this country and the richness that we have within the environment of being here in Toronto. So, as I said, we have over 200 exemplary and very diverse clinical sites that are available to all of our students. Our geographic catchment area, like OT, ranges from Oakville to Ajax Pickering and north to Barrie and to the lake in Toronto. And a number of our students also go into international types of opportunities. Our sites are divided into 6 major categories, which we've talked about: the acute care hospitals, our rehab and long-term care facilities, our pediatric centers, and we have some of the most preeminent pediatric centers in the country. We have a number of outpatient facilities, community services, and we have some opportunities, if people are interested in administration, to be mentored and do an internship with an administrative type of or research type role. So some of our affiliated sites include Sunnybrook Health Sciences Center, which is to the north, Sick Children's, which is just across the street, St. Michael's Hospital, which is our urban angel, which is a little bit south of here, and the Toronto Rehabilitation Institute, which is literally next door. And the full list of all of our internships is, or all of our clinical sites, is on our website. So with that, I'm going to pass this over to Daniela to talk to you a little bit about some of the admissions info. And then we can take questions after that.
Okay, so hi, I'm Daniela Preglia. I'm the registrar, the grad admin in the department, and I also handle all the admissions and recruitment information. So if, like Sharon said, if you have any specific questions to your situation, we can take them after the presentation. Okay, and some of this will be similar to the OT presentation. Some will be a little bit different, but because we are recording it for people who can't attend the session, I apologize for the little bit of repeating that we'll have. So we have 2 parts of assessment. We have a non-academic assessment and an academic assessment, which I'm going to start with. So we also require an appropriate bachelor's degree with high academic standing from a recognized university. An appropriate bachelor's degree typically has 75% liberal arts and science content, which is almost any bachelor's degree. The only degrees that sometimes don't meet that requirement are degrees that are based on fine arts or theological degrees. And if that applies to you, then you can just come up and talk to us afterwards. For the PT program, it is very competitive, so we look for an A- to A average over your last 20 half credits, which is typically your last 2 full years of school. And the cutoff for 2015 was a 3.8, which is basically right in between an A- and an A. And we also require prerequisite courses. Our prerequisite courses have to be completed within the last 7 years, and you need to have a grade of at least a 70 or a B- as recorded on your transcript in these courses. They're listed here. We also have them available on our website, and you can also verify the physiology, the anatomy, and the stats or research methods from your specific school at this page on our website. So I have Canadian universities from all over listed on the site, and you can actually check your specific course to see if it's pre-approved. If you took a course that isn't on the list and you think it should be, there's also instructions at this website about how to contact me to ask if it can be added to the list. For the non-academic assessment, we also require 2 references. So it's an academic reference and a professional reference. The academic reference should be a professor. We also accept a TA. And for the professional reference, the most common are an employer or a volunteer supervisor. These people don't necessarily have to be from the healthcare profession, but they should be able to speak about your abilities to work within the healthcare field. Keep in mind that if you're applying to multiple PT, OT, SLP programs within Ontario, all the programs are going to receive the same reference letter. So you only do 1 academic and you do 1 professional reference for all the programs that you're applying to. So other schools might have different criteria, but we don't require that a professor has tenure, say. As long as they instructed you in a course, then that's fine. For PT, we do also have a second stage step in the process. It's called the Computer Administered Profile. It's basically an admissions test. It's a test that's completed on a computer on a specific day in April, and you can find the date. It's already been announced. It's on our website. And we'll ask similar questions as to those you would expect in an interview. It's just you're going to be writing your responses instead of verbally, saying them back to an interviewer. We might give you a specific scenario and ask how would you respond, or we might ask you to give an example of something, and we do expect that you have knowledge of the profession, but we don't expect that you know how to fix, someone's sprained ankle. I'm just going to spend a couple slides going over how GPA is calculated, because I know that's something that is sometimes confusing for people, and it's also helpful for me to have this on our website so I can send this link to people who ask these questions. So as Aleem had already mentioned, we look at your last 20 half credits completed by December 31st of the year that you're applying. Summer courses with grades are also included. And if ORPAS has to go back into a previous academic year to take even 1 course, say, it's going to be a weighted average of the entire year, fall and winter terms. And I'm going to go into a specific example just to go over that. So say most people, they're currently in their 4th year when they're applying. So by December 31st, you will have completed 15 half courses throughout 3rd and 4th year. So which courses are going to be used from 2nd year? So what we're going to do is use all the 15 half courses from 3rd and the fall term of 4th year, and then we're going to take the entire average of your 2nd year, so fall and winter, and we're going to use that average for the last 5 outstanding courses. And I have a chart here, so you can see, so from fall 2015, you have your fall term that's done, and so all 5 courses with grades are going to be counted. In your 3rd year, which would have been fall-winter 2014, you have 10 courses, and they're all going to be counted. And then from your 2nd year, you also have 10 courses, and they will all be counted, but they're weighted at only 5 credits. So let's say your average from 2nd year is like a 3.54. It's going to be like you got 3.54 in 5 classes, and those are added into your overall GPA. So if you have a specific question about how your GPA is going to be calculated, you can come and ask Aleem or I after the presentation. Does that make sense, though? Is that generally? Okay. Aleem already touched on this scale. So this is the scale that ORPAS uses. Most Canadian universities are on this scale. If you're from U of T, U of T uses the 3 and the 7 scale. So the thing you have to keep in mind is that you actually have to convert every single grade into a number on this 4.0 scale. I know U of T gives percentages. You cannot take all those percentages, find an overall average, and then convert that. It does not work like that. You have to convert every single grade into a number on the 4.0 scale and take the average from there. You also should not be using the the average that might be on your U of T transcript or other school transcript, because it is not necessarily the same. I know at U of T GPA scale, they consider an A or an A plus a 4.0. That's not the case with this chart. An A, which is an 85 to an 89, is worth a 3.9. Okay, so just keep that in mind. Here's some enrollment data for PT for the last few years. I also have a huge chart on our website if you want to see bigger trends, but you can see from this it is a very popular program. All the PT programs in Ontario are very popular and see a lot of applications. So we had about 1,100 applications for roughly 90 spots, and our GPA cutoff to be invited to our admissions test was a 3.8. So that means applicants last year had to have a 3.8 or higher over their last 20 half credits to even be invited to the cap. If the GPA was below that, then they were not invited to that stage in our process. Here's a sample of what our class looks like from this year. So, I mean, at least 80% have some sort of science degree. We do not favor science degrees. I just think that a lot of people who come from that background are interested in PT. We do have some students with a Bachelor of Arts, so as long as you have our prereqs, then that would be fine. And we do have a handful of people who have a master's degree. One difference between us and OT is that we do count graduate level marks. So if you have completed a master's degree, your GPA will be recalculated by me in-house once we receive your application from ORPAS in January, February. This is a very similar slide to what Aleem already showed. So, know your financial needs. Tuition, it's the same amount in PT. So this year it's $11,500 per year, and it is a 2-year program. If you're living downtown, say with a roommate, you rent, food, your cell phone, internet, all that kind of stuff, including tuition, we say around $26,000 a year. It is an average, so I see people who spend a lot more than that, but you probably could do it for around that. Again, costs associated with placements are your responsibility. Placements are not paid positions. And availability of scholarships and bursaries for students in these professional programs is limited. We will always notify you if we do have any in-house bursaries or if we're running an OGS application. We will send out emails for students in the program. But we really want you to have a financial plan in place before coming to the program. Exact same application details as with OT. So you apply through ORPAS. Make sure you complete the whole application. ORPAS acts as the hub. You send everything to ORPAS, and ORPAS will disseminate your information to all the schools that you've applied to. The deadline to apply is January 8th. References are supposed to be in by January 8th. Transcripts are the only thing that can come in a little bit later. So transcripts, if you're from an Ontario university, you order your transcripts through the application, and ORPAS will basically get the electronic information from your school and send it to us electronically. If you're from a university outside of Ontario, then you would be responsible for ordering the transcripts and having it sent to ORPAS. And that you have until the